And we're back on Talking Together. We're joined by one of the amazing mayors fighting the coronavirus in Rochester, New York. Welcome to Talking Together. How are you?
Thank you. I am so excited to be here and to be on Talking Together. Appreciate the feature on mid-sized mayors. Rochester is the third largest city in the state of New York. We have a population of about 210,000. So definitely really thank you for the opportunity.
Well, and I think that's sort of, one of the reasons why we're having this conversation is because I really do believe, Mayor Warner, that voices like yours are really missing when we have this larger contextual conversation of how we as a country are fighting coronavirus and the impact that it's having on communities that are not necessarily the ones that are in the spotlight. So you hear about New York, you hear about Chicago, you hear about Detroit, but nobody's talking about what's happening in Rochester. So let's start there. What's happening in Rochester, and how are you guys sort of fighting and tackling the coronavirus?
So currently in Rochester, we have about 1,300 confirmed cases. We have about 22 patients in the ICU and 112 deaths. We have done a great job of actually minimizing and lowering the curve. We did not see the influx that we thought that we were going to see given what's happening in larger cities, but we were able to learn from those cities. So I think that was very important. When Mayor Breed in San Francisco decided to shut down, and we saw the things that she was doing to flatten the curve, it was like, okay, should we be doing that? We're contacting our county health director to have those discussions. And then within the next week or two, we were also shut down. And so we had our first case very late. And so we were able to learn from other places. Part of that, being able to do that, was to be able to prepare to make sure that we were ready for in our hospital system, but also that city government, as well as our schools and other places, had the information, as well as our citizens, that what was happening across the United States and what they could do to prevent the spread right here in our community.
So let's start having this conversation and talk about hospitals for just a second, because hospitals have sort of been ground zero for fighting coronavirus. And when you talk to the governor of New York, he does daily press conferences, sort of become a living room hero. Everybody watches them, right? But he talks about how, in order to sort of flatten this curve, as we are now in week 6 of, for most folks, their stay-at-home order, is that we've got to decrease hospital capacity. How is that working in Rochester? And what does it mean when the governor says we need to take hospital capacity down to 70 for you?
So one of the things that happened very early on, when people started to feel sick, they said, okay, everyone, don't come to the emergency room. Let's stay home, call the county health department and call your doctor, and let us try to figure out whether you're exposed or not. Let us make sure that we get you into testing in a secure way so that this doesn't get spread by people sitting in the emergency room, coughing and doing certain things like that. So our hospital system responded very, very well to the problem. We do have of course, everyone knows that the ventilators and other machinery that would be need for someone to actually survive this. We had enough on hand to be able to respond to those individuals that needed it. Unfortunately, we did lose about 109 people here, and we still have a number of people in the ICU. But it did not spread the way that we thought it was going to spread, and we were prepared for the worst and we prayed for the best.
So talking about preparation, and part of preparation in any strategy, and one of the sort of tools in any mayor's toolkit is this ideal of how fast can we test people. One of the quickest ways to slow the curve or to flatten the curve is by testing. We've heard this for 6 weeks. Now, what you hear from the White House, and you hear from the White House's task force, is that we're doing all this test, all these supplies are out in the field. What you're hearing from some governors is we have some tests, we don't have enough tests, we're prioritizing. Now, from your vantage point, are you getting the supports that you need to conduct testing in your city? Mind you, like you said earlier, your outbreak wasn't as bad as it was projected to be because citizens in Rochester decided that they were going to stay home, they were going to wear masks, they were going to sort of take all the necessary precautions. But do you have the resources that you need to make sure that folks who want to get a test for the coronavirus can get one?
We do not have enough tests. So Governor Cuomo is absolutely 100% right when he says that we do not have enough tests because, every day I get people to call my office that want to be tested. We have opened up more testing sites across the board, and we will continue to do that. And the governor and the State Department of Health have decided that they were going to do some antibody tests as well. And so there's a number of different testing sites. There's, different types of tests that you can actually get. But when we say, do we have enough tests? In all transparency, no, because, if you're not experiencing symptoms, if your doctor has not called or the State Department has not sent you to a location to be tested, then you will not be tested. On Sunday, I believe the governor had released the order that all first responders here in New York State could get a test before first responders only experiencing symptoms or that was exposed to someone that had the test would be, or that had the virus would be tested. And so I think over time, we're starting to ramp up. We're starting to prepare for that. But across the board, there is no community that has enough tests to test everybody to make sure that they do not have this problem or this virus.
Talking about first responders for a second, I'm glad you brought them up. How are your first responders doing? I think that is sort of, you see the folks at 6 p.m., they do the cheer for all the first responders, but how are your first responders holding up, understanding that this disease, they're sort of the front lines, they're the troops that are fighting this battle. How are they holding up at this stage?
So, I have to say that I am very proud of our first responders and all the first responders across the community and appreciate them for their service. In the city of Rochester, one of the things that we did early on was make sure that our first responders had the proper PPE. And so we made sure our police officers had masks, they had gloves. The governor sent down sanitizer. We have our police cars in one of our local cleaning companies. They come in, they sanitize the police cars. The same thing with our fire department. At this point in time, we have had no police officers that have been diagnosed with the virus. We have had no firefighters that have been diagnosed with the virus. We had some that have been exposed, but of course were quarantined, but never came down with the virus. And now, and because of that, because they weren't experiencing any symptoms or anything like that, then our first responders weren't necessarily being tested. But now on Sunday with this new order, then they can get in the queue to be tested. But I'm thankful that we were able to get the PPE. We were able to change how we deliver services. So firefighters who literally in Rochester are the first responders to like a priority one call, a health call, who get there before our ambulance service, stop going to certain calls. Our Dr. Cushman from the health department pulled them back from certain types of calls so they wouldn't be exposed. The health department through the 911 office would tag a person's house. So if somebody's on quarantine in the 911 system, the fire department and police department would know that this house, that there's a person that is under quarantine, could possibly have the virus or do have the virus. And so proceed with caution before going into that home. And so there were a number of different steps that we took to protect those people on the front lines. Even our DES workers, because at the end of the day, government.
Now DES, what does that mean for folks who are listening?
Department of Environmental Services. Most cities call it Public Works. So the people that are cleaning our buildings, the ones that are picking up garbage, picking up recycling. We did the same with them. Made sure that they had the proper PPE to clean our buildings. to actually go out and pick up garbage. We stopped doing bulk refuse collection. So if it couldn't fit within the garbage can, our automated garbage system, then we told our residents, don't put it out right now. We're holding back on that. So there's a number of things that we did, and I'm thankful to our first responders because they're the ones that listened. They protected themselves as well as protected the public and going out.
Now, talking about first responders, I want to sort of talk about essential workers, right? So grocery store clerks, the folks who are delivering food, Uber Eats, right? And you talked about how you guys equipped firefighters and police officers. Now, one thing that we've heard all across, one of the big stories sort of moving is the fact that coronavirus is moving through various food plant packing facilities, butchering facilities, a Smithfield plant. How are you working to flatten the curve amongst the essential workers, the only folks that I guess that we see outside of the first people that we're quarantining with when we go to the grocery store, when we go to the hardware store, etc.?
So here locally, most of our businesses, whether restaurants or even the grocery stores, they have put up plexiglass, and so they make sure that people within the stores actually maintain distancing. They have only let a certain number of people within a store at a certain time. The cashiers have all been given masks. It took some time, but have given masks. It took a couple weeks, really, because at one point in time, and that's the thing about this virus, in the beginning, it was basically trial and error. You had information, and it was like, oh, well, but you can do this, but you can't do this, or do this or don't do that. And so once one of the things that we did was listen to the commissioner of the Department of Health, and what they said, we actually complied with. So when they said everybody must have masks in public, then as a community, we started, giving out masks, telling people how to make masks, making sure that our essential workers have masks and things like that. Grocery stores have gone as far as to put up, as I said, plexiglass between the cashier and the customer. Every time a customer finishes, they have wipes that they go and they spray the machine down and wipe it down. And so we're doing everything that we can to continue to flatten the curve and make sure that our essential workers are not exposed.
Now, speaking about grocery store workers, I think the other thing that we've heard is that there's been some food shortages. I mean, even here in the nation's capital, you can't find toilet paper, you can't find hand sanitizer, which is given, but there's times where you can't find eggs or you can't find this product or that product. Are you guys having the same problem in Rochester when it comes to having your grocery stores and your essential stores fully stocked with supplies, nourishment?
In the beginning, we had a problem, but now we have not seen that. And I don't anticipate that we will see that. In the beginning, of course, everyone was scared. They went in, they, picked up everything. But now I've gone to the grocery store several times and I see that our place is stocked. I do believe that, given the supply chain, that eventually it will start to hit our community, but it hasn't yet. One of the things that we're doing on a daily basis is my Department of Youth and Recreation is handing out food to children and families that live in our community from our recreation sites and also from school sites, even though schools are closed, because that was one of the first things that we wanted to make sure that our students had the proper nutrition. And that was one essential thing that they did not have to worry about. So we've handed out over, I believe, 300,000 meals working with our local food bank and the city school district. These are prepared meals every day. We do breakfast, lunch, and dinner, except for on the weekends. And on Fridays, we give a package so that they can have that over the week.
So Mayor Warner, I want to put a pin in that, right? Because I think that is the story that is really untold. You know this because of the work you do as a mayor. We know this here at Talking Together because it's a story that we've been following. We had a panel 2 weeks ago with 3 educators talking about this same thing, right? Is that what you're seeing all across this country, especially in places like Rochester, right? Is the school system was part of the sort of service beyond providing education, provided services to the people of your city. So for vulnerable students, for vulnerable families, that meant 2 hot meals a day, right? For parents, that might mean a social worker. With schools now being closed, you talked about delivering 300,000 meals. Are you guys able to serve your most vulnerable populations? And is there anything that you can is there anything that you guys are doing differently to say, listen, we know in Rochester, we have these vulnerable populations and we know we have to serve them differently. Is there anything that you're doing differently that's not being talked about?
So I think that what we're doing is working as a consortium. So all of the social service agencies, the not-for-profit agencies working hand in hand with government to deliver those services. One of the things that was very important right now, of course, is making sure that people have a place to live. And so we are making sure that people are not being evicted, that they are able to stay in their homes. The second thing is making sure that they have food to eat. So through working together collectively, we developed a process by which we can feed the masses. For our senior citizens, we work with the not-for-profit organization Lifespan, as well as Meals on Wheels, to make sure that seniors are getting meals as well. And so those essential services and basic needs had to be met in our community, and everybody stepped up to the plate. Our philanthropic organizations donated money to make sure that this could happen as well. And I think that that's very, very important to the delivery of services to the citizens of Rochester.
Wonderful. Now, what population in your community do you believe is the hardest hit? We've heard stories about how this disease has disproportionately impacted African Americans and Latinos and Latinas. What in your community, in your city, which population has really been the hardest hit by this?
So across the board, our senior population and senior citizens have been the ones that have passed away from this and been hardest hit. Now, when we look at the data and the people that are in the ICU or on ventilators, those people, 70% of them are African American or people of color, African American or Latino. So when we look at deaths, you don't see the disparity. But when you look at ICU, patients in the ICU are on ventilators, you see a wide disparity on race and ethnicity playing a part in that. And that, of course, has a lot to do with, a couple things, I think. Number one is the underlying conditions in the healthcare system overall. It just rises to the top. And the fact that African Americans and Latino are more apt to have obesity, diabetes, hypertension, and those types of things. But overall, when we look at where we had the hardest hit population, it's in our senior population, and that's the most vulnerable in our community right now.
So talking about that, because I do think that as we think about coronavirus, we have to start having a conversation about the future, right? What happens when we reopen business? And I think you brought up such a reopen business and reopen society, for a better term, right? But you brought up such an interesting thing is that those that are underserved, which I think it's interesting that you see the mainstream media sort of saying, oh, well, look, it's impacting African Americans. But I think what the data says is that African American communities, Latino communities have been underserved already. And what this coronavirus has done is really just sort of exposed what was an underserved population. And no matter how hard mayors like yourself try, they're still underserved because the resources aren't, it has to be collaboration from the federal, state, and local level. So talk to me just a little bit as we sort of turn the curve, in lieu of a better phrase, right? And sort of work on what does America look like and what does cities like Rochester look like post COVID-19? Where are you going to be focused on what populations do you be focused on making sure that they get what they need so that this doesn't happen again?
I think it's a 3-tiered approach, right? So the needs are different depending on the population you're trying to serve. So for our most vulnerable residents, those senior citizens, those people that have underlying health conditions, once we turn the curve or the economy and the system starts to open up, they're still vulnerable, right? So this problem just doesn't disappear. So we need to make sure that we are continually to proper educate them, that we're making sure that they are getting their healthcare needs met. We work with our not-for-profit organizations to definitely respond to them and to hopefully put together a system where we can have some daily sort of reporting and tracking for them so that they are not lost within this whole everybody is opening up and so everybody's in the same sort of boat. For our businesses are different because what we do know is that there are some people that are making much more money on unemployment right now because of the CARES Act than actually working, right? And so if you opened up the economy, will these employees that were basically service employees go back to work, or are they going away? So you have to figure that out with working and assessing the businesses and the business environment by talking to people and talking to the businesses. The third is, the people that are in the middle, those, young professionals or those healthy middle-aged folks, and making sure that they also understand the obligation that they have to the seniors when they go back into the workforce to continue to not only practice social distancing, but cleaning, washing hands, all those other types of things that we would have them to do. So I think it's an approach that based on the population you're trying to serve, you have a different method and a different methodology of how you can get to them and provide the resources and the support to them.
Now, you said one thing that I haven't heard anywhere on television. I think it's such an interesting piece, right? Which sort of speaks to the fact the Schott Foundation says that our cities aren't as loving as they should be. Our country's not as loving as it should be. Because I just wonder, I wish I could rewind the tape of it, because I think there's something so interesting when you say there are folks who are sitting at home who are currently making more on unemployment than they were making in their 9-to-5, 40-hour-a-week job. How do we fix that, Mayor? Because that right there is a huge chunk of the problem. When you talk about underserved, when you talk about communities that can't see a doctor, that can't afford healthcare, there's where it is.
So one of the things that I have been trying to do for a while here in our community is we have a significant number of what we consider working poor. And those working poor people are the ones that are unfortunately in the healthcare system as healthcare aides or home healthcare aides, and they're being paid under $15 an hour. And so those people are now the essential employees that we're talking about, but also those bus drivers that are driving kids to school. My sister, my aunt-in-law is a bus driver, and she said, listen, there's no incentive for me to go back to work, and I hope they're not going back to school until after July 29th. And so those types of things is that we have to look at what is the problem in the system. And if we have the money now to pay all of these people, that are on unemployment, why is it that people have to struggle every day to get paid what they're worth and in the work that they're doing? We have to look at the system, pay people equitably for the cost of living that they are residing in. And it shouldn't take somebody working 80, 90 hours a week to take care of their families that to be able to earn the living, to be able to pay their rent, be able to pay their RG&E, be able to put food on the table. The system in and of itself needs to be reset. And on the other side of this, that's what we should be looking at.
Now you made the perfect transition. I didn't even have to make one. So let's talk about what a new system looks like. You will sort of be on the front lines of what a new system looks like, because it will happen in cities. It will happen in states. It will happen in counties. And so before we get to that part we just talked about, right, which is what those services look like, I think one issue that people have started to realize is that because of all the spending, the new spending that had to be done by cities like Rochester and the state of New York to sanitize, we talked about some of this new spending, getting PPE for all of your first responders, sanitizing police cars, changing up how you do 911. All of those things come with a price tag. And that price tag has pushed a lot of cities and a lot of states' budgets to the max, right? So, and I think that is, as we're debating this sort of next stimulus package, that's what it's going to be about, is in this recovery, how do we ensure that cities like Rochester can provide the services that they used to provide, given that now a lot of their money has been diverted to deal with the coronavirus. Now, you're somebody who manages your city's budget. You are part of that process. What is the one thing you want lawmakers in Washington to know that you need right away to make sure that your budget works so you can continue serving people?
We need money. I'm not even to sugarcoat it, and I have to really thank Senator Schumer and Senator Gillibrand, and because they both have been on the front lines of this issue. At the end of the day, it costs for us to be able to have police officers, firefighters, pick up trash, and do all of that. Cities, well, my city, the three top ways that we fund those services is through property tax, through sales tax, and through aid that we get from our state government. Two of those streams of dollars have been significantly impacted. The governor has talked about the fact that the state that has, are billions of dollars in debt, their revenue stream has been cut. Sales tax, nobody's out really spending money. Food is not taxable. And so therefore, that is completely impacted. So, I've spoken with Senator Schumer's team and Senator Gillibrand directly and all of them and said to them, we need the resources to be able to continue to provide services. We're in, my budget cycle is from July 1st to June 30th. I'm right now in the process of developing my budget, and we're looking at not only furloughs, we're looking at layoffs, we're looking at possibly having to close firehouses because we can't predict the future, and we don't have the relief and the money at this point in time to say that we're going to be able to provide these services. Government needs the dollars in order to make it work for the people. And I know across the country that all of us are in the same boat and we need that relief. One of the things is that it has to come directly to cities to be able to provide that relief to our citizens. I hope that they will not put a cap on population, because we have a lot of small town mayors, especially in the African American Mayors Association, that currently don't have any PPE to give to their police officers, that are struggling every day to be able to make payroll. All of those things, we have the same issues as businesses have, but we're expected to continue to provide exceptional service. I want to be able to provide the service to my residents. I need the resources in order to do so.
And what resources are you looking for? You said obviously money, but where do you need that money? Where are some of your budget holes? So if there are any lawmakers watching, if there are folks who are staffers of law, where are the budget holes? I mean, obviously we know we need to shore up first responders, right? Because closing a firehouse or closing a paramedic department, or what paramedics usually housed at firehouses, right? Closing that could have a huge impact on whether or not there is a second wave of this thing. So where do you guys need the resources exactly?
Unrestricted aid to municipalities that will allow us to replenish those revenue streams. So, for example, one of the things that happened in the CARES Act, we are very thankful for, was we got CDBG dollars, that's community block grant dollars. We also got ESG dollars, which emergency service grants that we could provide our residents and our businesses. So that was money that came to the cities that we basically push out to our businesses, to our residents, to our not-for-profit organizations that are providing social services to the most vulnerable population. That was not dollars that we could use to actually keep police officers on the street. So we need dollars that will allow us to be able to replenish our revenue streams so that we can keep our officers and our firefighters and those essential workers that are out there every day out on the road providing the services to our residents.
Now speaking about that, you talk about what you need from the federal government. I think that will amplify as we sort of move into the next phase of coronavirus, which is what reopening looks like. Has the city of Rochester started to put together a reopening plan? And if so, what's in it?
So yes, we have an internal team that have started to put together this plan. It's not developed yet, but I can tell you the things that we're looking at. And it's the same thing that I said, it's a three-pronged approach. The first is, one of the prongs is, okay, about our businesses. What do our businesses need to come back and to come back stronger? How many of them are closed? How many of them remained open, right? The second is, okay, our workers. So what do our workers need? How many workers are willing to return back to work if we opened up 2 weeks from now, right? And what does that look like? The third, of course, is our children and education. And how does the educational system serve our children and them being able to continue their educational process if we decide to open up this year? If we do not, how do we make sure that they still get the support that they need in their home in order to be able to continue their education? And so we have to look at each of these in a different way and evaluate and work with our community partners to know what affects the city school district may not affect a private institution that has 700 children when we have 26,000 children in a city school district. And so we have to build a plan that tailors to the individual population that we're trying to serve. And each of those segments are different, and we cannot have a one-fit-all approach.
I couldn't have ended this interview better. Mayor Warren, thank you so much for being with us. It means so much to have you on the show, Mayor Warren, and thank you for the work that you're doing to ensure that the people of Rochester are safe and healthy. And thank you, because what's actually happening is that what you said at the beginning of this interview, we work together, we work with city services, we work with our community, and we've actually flattened the curve. It's not as bad as we thought it would be because we work together as a community, which is how we're going to overcome coronavirus and how we're going to reopen this country. Thank you so much for joining us on Talking Together. We so appreciate it.
Thank you for having me. I definitely appreciate it. And thank you for your reporting and for featuring other cities in this crisis.